Venezuelan economic collapse 2016. The only question now is whether Venezuela's government or economy will completely collapse first. The key word there is completely. Both are well into their death throes. Indeed, Venezuela's ruling party just lost congressional elections that gave the opposition a veto-proof majority, and it's hard to see it getting any better for them anytime soon, or ever. Incumbents, after all, don't tend to do too well when, according to the International Monetary Fund, their economy shrinks 10% one year, an additional 6% the next, and inflation explodes to 720%. It's no wonder, then, that markets expect Venezuela to default on its debt in the very near future. The country is basically bankrupt. That's not an easy thing to do when you have the largest oil reserves in the world, but Venezuela has managed it. How? Well, a combination of bad luck and worse policies. The first step was when Hugo Chávez's socialist government started spending more money on the poor, with everything from 2-cent gasoline to free housing. Now, there's nothing wrong with that. In fact, it's a good idea in general, but only as long as you actually, well, have the money to spend. And by 2005 or so, Venezuela didn't. Why not? The answer is that Chávez turned the state-owned oil company from being professionally run to being barely run. People who knew what they were doing were replaced with people who were loyal to the regime, and profits came up but new investment didn't go in. That last part was particularly bad, because Venezuela's extra heavy crude needs to be blended or refined, neither of which is cheap, before it can be sold. So Venezuela just hasn't been able to churn out as much oil as it used to without upgraded or even maintained infrastructure. Specifically, oil production fell 25% between 1999 and 2013. The rest is a familiar tale of fiscal woes. Even triple-digit oil prices, as Justin Fox points out, weren't enough to keep Venezuela out of the red when it was spending more on its people but producing less crude. So it did what all poorly run states do when the money runs out. It printed some more. And by some, I mean a lot more. That, in turn, became more lots than you can count once oil started collapsing in mid-2014. The result of all this money printing, as you can see below, is that Venezuela's currency has, by black market rates, lost 93% of its value in the past 2 years. Venezuela Food Crisis 2016. You name it, Venezuela is short of it. Meat, fish, fruits, sugar and bread. The government just doesn't have enough money to pay for them. It's created a staggering humanitarian crisis in Venezuela, where citizens don't have enough food to eat. Looting and riots have rocked the country. The declines in exports of certain food categories are staggering. Bread shipments to Venezuela fell 94% in the first half of 2016 compared to the same period last year. That's $216,000 worth of bread this year, versus $3.5 million last year. Meat exports declined 63% to $127 million, from nearly $350 million last year. Exports of fruit such as bananas and strawberries plunged 99%, to $159,000. From $21 million. Fish exports dropped 87%. Sugar fell 34%. The numbers come from Panjiva, the global trade analytics firm, which pulls data from the United Nations, U.S. Customs and other governments. For this article, Panjiva pulled export data from the United States, Brazil, Colombia, Ecuador and Chile. Venezuela likely gets food from other countries that were excluded from this analysis. Venezuelans can't buy bread and meat, and all you can't really get is cereals. The really basic stuff, says Chris Rogers, the research analyst at Panjava. Venezuela's economy has plunged into a deep recession and the country is fast running out of cash. The key problem behind Venezuela's inability to pay its bills is that the value of its currency, the Bolivar, has plummeted dramatically in the last couple of years. That's made paying for food imports prohibitively expensive. The Brazilians aren't unwilling to sell meat to Venezuela. It's not a political thing. The Venezuelans just don't have the money, says Rogers. Venezuela healthcare crisis. Nowadays, Venezuela is a powder keg. A major objective of the Chavez government following the Bolivarian Revolution was improving healthcare for the Venezuelan people, and they built thousands of new clinics, hospitals, and diagnostic centers across the country. Mission Barrio Adentro is only one health program among many, such as Mission Milagro, Mission Gregorio Hernandez, or Mission San Rosa. But now, the risk is great that all this progress will vanish and poor people will suffer more than anyone else. Anyone looking back on Venezuela a decade ago would be shocked by what is going on in the country today. The political left in Latin America that admired Venezuela's ambitious socialist project and hailed Venezuela's socialism as an appealing alternative to market-based approaches. But today, nothing to save remains. The country is facing an unprecedented meltdown. The economy has collapsed. Between 2015 and 2016, the GDP is projected to contract 18% and the inflation is forecast to reach 700%. In the whole country, energy shortages leave cities and villages in darkness for hours every day, and the health system is barely functioning due to shortages of basic equipment. The origin of that situation is the collapse of oil prices, Venezuela's only significant export, and because of this the government revenues could fall by 40% this year. The Venezuelan constitution defines health as a fundamental social right and guarantees a free national universal healthcare system. As such, the whole healthcare system was reformed and the Mission Barrio Adentro was implemented. This plan is a model of comprehensive health management, including development of surgeries and clinics in communities with little access to conventional health system structures such as large hospitals. In addition to this phase, the Barrio Adentro mission comprised 3 stages. Mission Barrio Adentro II, which provided free comprehensive service through the Centers for Advanced Technology (CAT), Integral Diagnostic Centers (CDI), and Integral Rehabilitation Rooms. 3. Mission Barrio Adentro II, which consisted of technological modernization and improvement of the infrastructure of the country's hospital network. And Mission Barrio Adentro IV, which comprised the construction of 16 new highly specialized hospitals. Additionally, the program brought Cuban doctors into the country in order to provide, even in remote rural areas, free basic medical care. But now, what remains of the program? Nothing more than aberrant propaganda and empty words. In the country's public hospitals, where treatment should be free, medicine, equipment and even food are increasingly not available. Antibiotics, power, electricity and even soap and gloves lack. A shortage of radioactive materials is also threatening medical services such as cancer treatments and diagnoses that are almost at a halt. Furthermore, patients in several cases have to buy what is needed for their treatment privately, thus ensuring a thriving black market and the rise of out-of-pocket payment stops. Every day, doctors have to fight trying keeping patients alive, and it is indicative that the death rate among babies under a month old in public hospitals, run by the health ministry, increased to just over 2% in 2015, up from 0.02% in 2012. Additionally, the death rate among new mothers in the same hospitals increased by about 5 times. The last May, Venezuela's National Assembly approved a bill to declare the national humanitarian health crisis that would force the ruling government of President Nicolas Maduro to accept foreign medicinal aid. In particular, the law will permit the declaration of an emergency, which allows Venezuela to receive medications as a form of aid from other countries, specifically in Latin America and Europe. Additionally, Venezuela would also be allowed to request assistance from the World Health Organization. Unfortunately, the health crisis continues. The president of the Pharmaceutical Federation of Venezuela, FIAT, revealed that drug shortages rise to over 85% in the country at the end of the last May. Public marches have been organized in the country, with doctors asking for medical equipment, and the problem is still urgent. The government is signing agreements to assuage public opinion. Last June, an agreement was signed to protect private health center users and insurance companies, which establishes the need to conduct frequent inspections in order to check for possible abuses and the correct functioning of the system. But all the measures taken are just a bait and switch. In fact, as the medical crisis worsens, the Venezuelan government continues to deny attempts to introduce humanitarian aid into the country. Specifically, it has denied several attempts by NGOs and opposition groups to bring humanitarian aid into the country, opting instead to import medicine from political allies such as the Chinese government. In June, the Maduro administration apparently blocked several requests to import free medicine into the dangerously crisis-ravaged state. The government explained that the foreign medical aid cannot be delivered into the country due to a lack of proper import permits, but doubts remain. Last week, the government reported that has distributed 18.7 million drugs and has signed a cooperation agreement with Cuba to import a not detailed amount of medicine. However, the president of the Venezuelan Medical Federation disputed that import is only for the benefit of those who marketed health, is to say Cubans, indicating that some medicines are actually produced in India and their quality is not proven. Although the government installed a hotline to improve drug distribution in February, Maduro is recognizing that this service is infiltrated by a mafia that is reselling imported drugs, overpricing them. Furthermore, the health minister, Luis, said that the efforts are made to cease with drug shortages through automated drug distribution system. But, if these measures will work, it is to be seen. This is not all. More than 100,000 Venezuelans crossed into Colombia over the weekend to hunt for food and medicine that are in short supply at home. It was the second weekend in a row that Venezuela's socialist government opened the long-closed border with Colombia. The situation is dramatic, and every day it is getting worse. Possibly, Maduro is trying to mask the country's stark state of affairs. But how long can he continue to do this? How many people would have to die before the Venezuelan government will? The only question now is whether Venezuela's government or economy will completely collapse first. The key word there is completely. Both are well into their death throes. Indeed, Venezuela's ruling party just lost congressional elections that gave the opposition a veto-proof majority, and it's hard to see it getting any better for them anytime soon, or ever. Basically bankrupt. That's not an easy thing to do when you have the largest oil reserves in the world, but Venezuela has managed it. How? Well, a combination of bad luck and worse policies. The first step was when Hugo Chávez's socialist government started spending more money on the poor, with everything from 2-cent gasoline Venezuelan economic collapse 2016. Incumbents, after all, don't tend to do too well when, according to the International Monetary Fund, their economy shrinks 10% one year, an additional 6% the next, and inflation explodes to 720%. It's no wonder, then, that markets expect Venezuela to default on its debt in the very near future. The country is based